You just get into it. There you go.
Hi, we're going to share the Botox treatment today. It really can do more than what you know. So I'm going to show you a few applications. Here we go. We're going to fixing this 11 or the front line. And here I'm going to demo on myself. So, since my muscle is not super strong, so I used a very small unit. So it's not going to freeze my forehead and give that a little bit gentle lift and softening this line. And another common application for the forehead horizontal line. And again, my muscle is not super strong. And I'm going to put maybe 1 or 2 units.
Does that hurt?
As you can see, I just cleaned my face. There are no numbing cream. There are no nothing. So it's just very well tolerated. A little bit bleeding, but that's going to subside. Okay, one more drop. Here. So most people require a little bit more depending on how strong your muscle is. But I like to do, very natural, soft way. So here we are, we're done with forehead. Another way we commonly address those lines, the Profeet. So again, as you can see, I got some, and we're going to put a tiny drop there, just softening it a little bit. Here we go. Few units, and this side. Those lines going to disappear. Here we go. Okay. And now we're going to come to the other indication for Botox, which is for TMJ, or V-shaping of your face. As you can see, I have pretty square jaw here. It's really because the chewing muscle is pretty strong. So I'm going to put Botox in there to relax this muscle. So I won't have TMJ, headache in the morning, and also my shape, my facial going to be a little bit softer, like a V. Okay, this requires a little bit more unit, but still for demo purpose, I'm going to put maybe 10, but typically people require about 20 to 30 unit on each side. Here we go. This area already been cleaned. So I feel the muscle right here. Here we go. And same on the other side. Does it hurt? It's really not bad. I mean, you really don't see, I'm hurting at all. So another part we're going to address with Botox today is fixing the under the chin. As you can see, when I do this movement, I have a lots of wrinkly or it's pretty strong chin muscle. What does Botox do? It's going to get rid of all this, orange peel things. My chin going to be a little bit smooth. It doesn't require a lot, and so here we go. And right in the middle. All right. So one more application is really useful for somebody with smoker line. It's more like a muscle training because people with smoker line, even they don't smoke, they have those little vertical line because they have strong muscle here. They talk with that. So by putting a little bit Botox in there, relaxes circular muscle, so softening those lines. But the side benefit is give you a little eversion of your upper lips, so almost like a little tiny lip filler effect. So I'm going to do that. Very little amount required. Here it is. That's it. That's all the Botox for facial treatment, and of course Botox other treatment. Running out the products, but we'll show you another easy way to treat is, you know, somebody when they bite down like really hard. I'm not sure if you can see. There are two vertical lines here, so Botox can be injected in there to soften those. And then another major application is putting Botox on your hand or feet or underarm for excessive sweating. Those are super effective. Here we go. So in about 5 or 7 days, all this factors should kick in, and it's going to be pretty soft and natural. Thank you.